Hi, we are really delighted to have Tami with us today. Tami is a university qualified medical herbalist, physiologist through BSc Honours at University of Wales, Cardiff College of Phytotherapy, formerly in Battle and London, UK. She attended Hofstra University, New York, with a BS in Exercise Physiology and Psychology and postgraduate fellowship along medical doctors in France in Neuroendocrinology, which is a brain and body hormonal speciality, through Herbal Medicine Remediation. Clinical nutrition guidance is part and parcel of each formal discipline, cultivating Tami's multidisciplinary approach to WellCare. She holds various diplomas and certificates of training in manual soft-tissue therapies for pain and rehabilitation, such as neuromuscular and osteopathic massage techniques, nearing 30 years in service, now focused exclusively as a telemedicine-based private practice. Welcome, Tami. It's lovely to have you here.
Thank you for having me.
It's so nice to have you. And so can you explain exactly how you're working these days since the pandemic, and how things shifted for you and how suited you are to the changes that are happening?
To be quite honest, not much has changed for me. I've been doing or providing telemedicine care long before it had a clever name. So I've been providing what I would always call care by phone, because we didn't have all of the communications and the digital tools to provide secure video. But I've been taking phone consultations since 2005. And officially offered care by phone as early as 2010. And it was really only through recent couple of years that the digital tools became more affordable and accessible for us. But I would say the majority of my patients have always been by phone because everybody's busy. And, nobody wanted to take time out to come into the clinic. And even in my own state, here in New Jersey, people often didn't want to travel beyond a few minutes. So phone consultations has been integral in my practice for many years. So this really wasn't a big shift. The biggest change was not having somebody come into the exam room.
Oh, wow. That's so interesting, isn't it? So you're really quite ahead of the curve then, when you started doing what you were doing in 2005, because it's so suited, isn't it, to these times going forward?
There was, I think, a theme throughout my professional life. And for you and Armand as astrologers can appreciate cycles and certain aspects about somebody's blueprint, their celestial blueprint, that they may be ahead of the curve. And I've always seemed to be about 10 years ahead of the curve in every discipline that I've done. So my first college degree with exercise physiology, I was met with a lot of snarky, quizzical responses. What is exercise physiology? What is that? And then in about 10 years, people caught on. The same thing with soft tissue body work, same thing with herbal medicine. It just seems that I've been about a decade ahead, maybe a decade and a half, and then everything catches up eventually.
Oh, that's fantastic. That sounds very Uranian, doesn't it, Armand? Very Aquarian. You must have strong Uranus transits, Uranus signature maybe in your charts, very Aquarian. I can relate to that too, actually, being
we all can.
Being astrologers.
Got it on the midheaven. So yeah, but I was going to ask you about that, Tami, because you're integrative and you talk about working with physicians and working with people's doctors and so on. And I wonder about that. I worked in healthcare as a speech pathologist for about 15 years. And yeah, I remember working in a very prominent hospital that they were trying to make, their idea of being very progressive was having all kinds of things to make people feel at home. So they had like a deli that served overstuffed roast beef sandwiches, French fries, huge sodas, and all of this. I think they're trying to make patients as well as serve them. But and I remember in that facility one time, one of the spouses of a patient asked if the doctor could prescribe vitamins that had been part of the regular regimen, you know, and if she had asked for the prescription for an exorcism, it wouldn't have been any different. The response was, "Oh my gosh, vitamins! What what sort of crazy stuff is this?" So things have changed, I'm sure. But what sort of pushback do you get? How easy is it to find people to work with? How do you broach that subject with people who? I mean, things may have changed, but I'm assuming it's an institution.
That is a great question. I would say I have some steadfast relationships with certain doctors, and that I know personally and professionally, that I receive referrals from, that I send referrals to. And for those, it's quite a facilitating relationship. It's actually something that foments a good energy, favorable patient care. And it's been a wonderful experience with them through over 20 years. I've known some of these doctors over 20 years and worked with them and their patients. A couple of those doctors actually came to me for care. So that's always rewarding. When it comes to physicians with new patients, it's mixed bag. Sometimes they will scoff or maybe roll their eyes at what their patients are requesting of them. Other doctors may go along with testing and just say, "I don't know why I'm testing for this, but sure, I'll run the test for you." Other doctors are more agreeable to collaborate and speak on the phone with me. So I would say it's mixed bag. I wish I could say that it was just one way or the other, but I have some spectacular relationships with some, and others who will say, "Well, it can't hurt, go ahead." And just
I'm sure it's an improvement from, I'm sure it is improving as time goes on, at least.
Yeah, you'll see actually some doctors that they actually prescribe quite a lot of over-the-counter supplementation. But I will preface that by saying I am more the anti-supplement herbalist or practitioner. I really try to get people to build a foundation on their diet. And then there are food concentrates where you're just taking a whole plant, freeze drying it, and consuming it in the course of a day. But primarily it's through fluid extracts that I work, because of the bioavailability. And I don't know if you want me to go into all the technical reasons.
Well, I know that you were talking about this in one of your videos about when you extract things from plants, you get this one particular chemical, but that might be valuable, but you're not getting the whole picture. And I know we certainly that would happen with cannabis when they tried to do the extracts and so on. Is a different effect, is there not, between the whole plant and the extract?
Absolutely. Once you take a component out of a plant, an active component, and you concentrate it apart from how it would occur naturally in the plant, you then produce a nutraceutical. And in some instances that can have a part in somebody's care, but it does alter the plant's natural ability to modulate its activity in the body. So you lose the balance with other constituents. Some of those are vitamins, minerals, enzymes, and there's other components that science has not yet identified that work in concert with the whole plant. So once you standardize a constituent, it's no longer traditional herbal medicine. It's plant-based, but it's not herbal medicine in its truest form. And then from that standpoint, if you go one step further and you pull that active constituent out and you just synthesize that one component, that becomes a pharmaceutical. So it's stages of, it could be plant-based, doesn't necessarily would consider that herbal medicine in its true form. But each has its place. I'm not anti-conventional medicine. There's a time and place and condition for everything. And so the key is to understand when a patient or an individual requires a medication, and then understand what plants can be supportive of that and not compete.
Yeah, that seems so ideal though, to work in that way. And as you said about the herbal medicine, it's you're using herbs in their rawer forms, aren't you? Where they're less synthesized and processed, so they have certain attributes that are going to be healing for the whole of the body, including, would you say, the mind, emotions? Would you say, when you're working with the herbs, you are thinking of how that will affect all of the organs at once?
Yes, you can only put just so many plants into one formulation and have the effects that you are looking for. There's variations amongst plants with the concentrations required to have the effect you're looking for. So you really look for plants to cover multiple bases in the approach. And my specialty is hormonal, and that includes brain hormones, which are your neurotransmitters, as well as endocrine hormones in the rest of the body secreted by your endocrine system. And so, we are looking to get to the cause of an imbalance, not simply replace a drug with a natural alternative. We can work symptomatically, and we do. I mean, if you're coming in with migraines, we obviously want to get you some relief, but then we equally want to look at what is causing the migraines. Is it a hormonal basis? Is it a food sensitivity? Is it a problem with elimination of waste? What exactly is the source of it? Are you consuming something in the diet that's triggering? Or is it emotional input that is disrupting the nervous system? So there's a lot that goes into selecting a plant, because there's no be-all superstar in the plant world. It's all a matter of nuances and what specifically the individual will benefit from, and reach the concentration so that it's not just blown away in a blizzard.
One thing that you talked about that fascinated me, but I maybe you just sort of touched on a little bit, if you could say a little bit more, is the difference between medical herbology that you do and herbology as you would see in Ayurveda or Chinese medicine, because they rely heavily on it. And I know you said it's more energetic based, but tell me more.
That is a perfect question. My training traditionally is Western herbal medicine. So it's all a matter of the approach to evaluating and assessing, and then the philosophies of going about remediation. So Chinese medicine you touched on works on meridians and energy systems. You have Ayurvedic, which works on doshas, which is more of a collection of tendencies, and they have 3 categories, and you may be a little bit of one and a little bit of another.
Pitta, Vata, and Kapha, that's it.
Correct. Yes.
Yeah,
and
studied that in India. Well, it was kind of quite a short course on it. It was so interesting. Sorry.
Yeah. So I use plants that may be used in each of those other disciplines, but my the way that I arrive at an assessment would be different.
Oh.
I hope I answered the question with that one.
Yes. No, you did.
Yeah,
You did.
yeah, no, definitely. It's just, it's so fascinating, really. I feel like I'm learning a lot about this. Yeah, compared to what I knew before I spoke to you.
Well, they each have value. You know, I do incorporate a little bit of each type of practice, because we know, for example, liver energy in the Chinese medicine is active between 2 and 4 a.m. And then you can back that up with the Western approach that around 2 to 4 a.m. is also when your liver is processing glucose and converting it into glycogen. There's a lot of liver activity at that time in the night. So if, for example, somebody keeps waking up at 2 to 4 a.m., then you explore what is somebody eating in their evening hours. What are they eating with dinner? What are they having after dinner? Did you have an extra glass of wine? You know, is your night sweat because you're processing that extra glass of wine, or is it because you're actually having a hot flash or a hot flush, depending upon what country that you live in?
Yeah, I always find it interesting that the organs are connected to emotions as well. So liver is anger.
Yep. And gallbladder is bitterness. So yeah, so resentfulness. Kidneys are sadness.
Yeah, sadness, fear.
Yeah.
Yeah.
So it's interesting when you look at that. But so I do take a more of a clinical physiological approach, but we can't ignore the profound input on the nervous system through emotions and non-tangible aspects of, like, energetics, like intuition and consciousness, and some of the more esoteric realm can play in.
But I mean, even the food you eat as well, affect your, your moods.
Yeah, that's another thing. Speaking about, and you can appreciate planetary effects, but I have a number of patients that will have their sleep disrupted with lunar cycles. So surrounding the full moon, many patients can't sleep well through the night. So the day before, during, and after, it can be disrupted sleep. And so we keep that in mind in the course of the month and their cycles and their medicines, reformulating based on what's going on with their body that does have influence from the moon, from lunar cycles. So it's really fascinating. You can be as clinical and researched with hard science in terms of conventional medicine research, but you really you have to at least remain open to the influence of energetics that are non-tangible.
Well, yeah, it's pretty fascinating, isn't it, that the Chinese 2 to 4 a.m. is the liver time, and then you find, okay, well, there's actually a lot of processing going on at that time. Well, even like the idea of anger being associated with the liver, that was a Western thing too. You're a little liverish, as they used to say.
Yeah, of course. Yeah,
expression of being angry.
That expression, isn't there? Liverish.
Yeah. It's interesting how it's evolved. We don't often know why we say the phrases that we say. We don't know where the etiology of where language comes from. And it makes perfect sense.
White with fear. People get really pale, don't they, when they're scared? There's something in that as well, isn't there?
Well, that goes back to my postgraduate fellowship with the doctors from France. Is the nervous system, the autonomic nervous system, and neurotransmitters. We all know serotonin, we know dopamine, but histamine, which actually, you know, from allergies, is also a neurotransmitter, and it is involved with the adrenal pathway. So it's quite intricate, and it's fascinating to me to pull the pieces of the puzzle together and make sense of it. But we have a lot of interplay between the nervous system and endocrine function and all of these human experiences.
Yeah.
Emotions obviously have a big effect on, well, I say that, but I mean, I think now we accept it. Most people say that emotions have a big effect on physiology. What about like that in terms of herbology? Is it, you know, I mean, are you, if someone's just sort of stewing in a kind of a bad place or something like that, or undergoing a lot of fear or stress and so on, would the herbs be treating the reaction to the stress, or would they be treating the consequences of it?
Well, I think that goes twofold, because you have to help manage the acute experience of anxiety, because it's a self-perpetuating cycle. So let's just say that you are anxious about, or a person is anxious about taking a test, or some relationship dynamics that are causing an emotional reaction. So you have an endocrine response, you have a fight or flight response that begins the process. But because of hormonal adaptation, it feeds itself. So anxiety will place a demand for a stress response, and then the constant stress response feeds into further anxiety and further depression. So it's a cycle. It doesn't just come from outside of ourselves or in our emotional body, but then it's perpetuated by the physiological body, because you have this constant fight or flight, but then you're not giving the body a chance to replenish itself adequately. So the key to responding to stress is the ability to recover from it. And that helps to stop the cycle of anxiety. It really feeds itself. And I don't want to get too technical and confuse anybody, but we have hormones at the level of the brain, neurotransmitters and hormones at the brain, such as prolactin. And when somebody is in this fight or flight, this constant anxiety, prolactin tends to rise. And when prolactin rises, dopamine and other hormones drop. So we have an inverse relationship. And unfortunately, the longer that happens, the elevated prolactins cause a mismanagement of cortisol and your adrenal hormones. So it's this constant metabolic cycle that sometimes people have a hard time breaking out of. And what I find ever impressive is the ability to help to manage the body's hormones, so that talk therapies and meditation and other practices can help give the tools.
I do. I help people with that through solution-focused hypnotherapy and psychotherapy, and it really helps. Yeah.
And you also are doing hypnosis now?
Yeah, so I do solution-focused hypnotherapy and psychotherapy. So the main reason people come to me is for the anxiety. So yeah, and it's that they can get addicted to those hormones, you see. But you see, it comes from the illusion. It's all, you know, it's basically it's in your mind. It's like you're imagining the worst, and as you said, you're getting used to that feeling, and then looking for triggers to experience it. So It's people getting sometimes addicted to that feeling, well, the cortisol, the stress levels. And as you said so eloquently, not being, when there's a expected threat out there, the body's not getting a chance to actually repair, is it? And so you must see this a lot in your practice, people coming to you with stress and anxiety that's,
and you need the tools.
You need tools, yeah.
So what you provide as a counselor are the tools to help break that rumination, because rumination, it's a hamster wheel, and it spins and never ends, and constantly putting the body into a fight or flight response. So I can support the body, and certainly help that cycle. But if you don't break the cycle emotionally, mentally processing, the rumination just keeps it spinning. So you do need tools to stop the spin and get off the wheel.
Yeah, I like that hamster wheel analogy, actually, because I use the analogy of a ski slope or a route that you're walking in the field, so you're walking down the same route all the time, and what's happening is you're creating a pathway, so all the grass is flattened, and then you start to get into a groove, and then before you know it, you're quite entrenched in this path. So that's your neural pathway. In order to let the pathway grow over, you just have to stop using it. You just have to break the cycle. So within 21 to 45 days, you can break a habit that's been lifelong. And it's by, just stopping that neural pathway from continuing and creating a new one.
Correct. And I can't do everything for a patient if they need to do that work on as well. It's the same thing with diet. I can provide some guidance, but they have to meet me halfway.
Yeah. I suppose you have the clients, the patients are the ones who really are ready to put that effort in as well, to work alongside you and to do what they need to.
Yes, and we hear a lot about manifestation, changing mindsets, that making the decision to do the work is paramount, because I can help support the body, but people do need to recognize the role that their mind is playing, and that there are tools and practitioners like yourself who can have a real world toolbox to reach for. I like that road. It made me think about years ago, I used to provide in-home treatments, and I remember driving the same roads, and there are grooves in the roads, and I felt like I was the one making the grooves in that road. I kept going autopilot on this road. So I like that idea of
that is the neural pathway, isn't it? That is exactly how it is. Or it can be a ski slope. You're going down the same ski slope time again, and again that's getting really deeper, and there's more and more of a groove in it. If you ski, you'll know what I mean, or you can picture it, and then once you stop going down that particular ski path, then again the snow starts covering up, and then when you create a new pathway, it might be difficult at the beginning because you've got to get a big whatever and kind of empty all the snow, and it's a lot of effort, but it's like anything, isn't it? Practice. It's just keeping that routine. And I suppose within the work you do, it is all about routine, isn't it? It's about continuing the same.
It's hormonal.
Yeah.
Yeah, it's hormonal adaptation. So we see that with even all of the hormonal pathways. So you have the adrenal, which then feeds into the reproductive pathway. The reproductive feeds into the thyroid pathway, And finally, the thyroid feeds into the pancreatic pathway. And so we see that with reproductive hormones that are influenced through the adrenal hormones. And we have adaptive measures to get around the stress. But unfortunately, like you said, we can get stuck in these alternative adaptations, and we can continue cellular metabolism. We can continue functioning emotionally and mentally, but we do so through what we call, in what I do, backdoor mechanisms. So for example, cortisol will then trigger the reproductive pathway. But if somebody's adrenal system is taxed, in order to produce estrogen properly, they will aromatize or convert another hormone called DHEA into estrogen. And you can keep that going, but then you have to pay back the piper, and that's side effects. And the side effects of that are androgen, overproduction of androgens, which can create everything from irritability, excessive facial hair in women, mood swings, weight gain, hair loss. There's all kinds of fallout to this, like you said, the grooves in the road, these alternate adaptive processes. And so the key here is to recalibrate and find the pathways, the better, more efficient pathways. So whether it's mentally, emotionally, or physiologically, we have to sometimes just recalibrate, and it takes time. It's what I do. I try to explain to people. I wish that herbal medicine was quick. You
just take herb and you're magic.
Yeah, but unfortunately, men and women alike, we all work on 28 to 30 day cycles. So anything that you're doing, you spoke about a certain span of time that you work with somebody to help to recalibrate their emotional responses. And it takes about 3 to 4 monthly cycles before we really start to see herbal medicine take the full expression of what we're doing. So you always look 3 to 4 months back to see why you're experiencing something new today. And then the same thing with any changes we make today. We have to really follow you along for 3 to 4 cycles ahead with hormonal aspects. If it's something acute like a urinary infection or constipation, you can get more expedient results looking at it in a symptomatic approach. So there's different ways. If it's acute, you do have to deal with acute or symptoms. But if it's a chronic situation, it's usually more hormonal and it takes a little bit more time.
So interesting. This again, it's the cycles, isn't it, which you must really understand in life. And do you think that that's what also interests you in astrology? The fact that we're looking at the planetary cycles and the cycles between the sun and the moon. And are you do you do any lunar gardening, that kind of thing? Are you into that idea?
On a professional administrative level, I do find that working with lunar cycles helps me be more productive, because I don't forget tasks that have to get done or when they're best accomplished. So things that are behind the scenes on a new moon, and things that I can launch or make aware to the public on a full moon. So
not Mercury retrograde. Not Mercury retrograde.
Yeah, I think everybody. I don't know anybody who has not yet heard of Mercury retrograde influences. I think it's so popular. You asked me about the awareness of the general public about what I do. I think that it goes hand in hand with other alternative, quote unquote alternative, out of mainstream philosophies, and that includes different types of holistic. You talked about counseling, but also hypnosis, even tarot and astrology. We see it growing exponentially in acceptance. And when I'm sure when you started in what you do, just like what I started in what I do, you get the eye rolls.
Exactly. But even with hypnotherapy, I think some people imagine that I'm a stage hypnotist, that I'm going to kind of, turn them into a mouse or something, for fun. I'm like, no, hypnotherapy, it's a form of psychotherapy. And are you finding though that more people are, people's knowledge of herbal medicine is, it's developing? People are much more open to consulting you, because you can look online and you can find, you can Google so many different herbs. But I mean, I take supplements and herbs quite seriously, including anything you can get in Whole Foods, herbal medicine places. So I would like the idea of just guessing my dosage, or because no, it's true though. I think some people
Tami, do you think that's a good idea?
I think some people maybe are more they just kind of go and buy things like ginseng or spirulina, but sometimes these things are not actually suited to them, are they? They might have a thyroid problem, or their digestion might not be good. So what do you think, Tami, about the fact that herbs are very accessible now, really, aren't they, in kind of high street shops? And
well, I would imagine it's the same thing with what you and Armand do, in that you're going to have certain segment of the population who prefers to manage themselves first and foremost. And we all need to be our own advocate, and we need to know our body and be aware of our body and our mind, and empower ourselves with general knowledge.
Yes.
So there are going to be people who will read up on, say, astrology, or they'll read up on self-care, hypnotherapy, and meditation, and all of those measures. And you have people who will go to the health food store and just talk to the clerk. They'll do some reading, and they'll say, oh, I have eczema, let me put some calendula on my skin. And there is a great empowerment to that.
Sure. I did myself as well, because I did train as an aromatherapist, so I do it with myself. I'm also aware of the fact that you're not always that sure with certain things. There are some things that you're thinking, oh, I wonder, like my maca and cacao, oh, I wonder if this is the right dose for, and yeah, you know what I mean?
Yeah, and so in that sense, for example, you brought up the food concentrate maca powder, and it's there are always some herb du jour, herb of the day, and you'll see it wildly populating the health food stores for a while, and then people will realize that maybe it's not suited to them. Like St. John's wort became wildly popular when at one point, and then people realize that it competes with a certain liver enzyme, so with antidepressant medication. So you can't take an SSRI or an MAOI, any of these antidepressants, along with St. John's wort, because they compete with one another. So I think usually the people that find me are once they've explored all they can on their own, and either they have a cupboard full of supplements that they randomly use, which random use is actually more, unless you're using it for a symptom. Taking something whenever you remember can sometimes put your body on a little bit of a roller coaster. So it's actually can be more detrimental. And if there's synthetic nutrients, then most of the time they come through multiple brokers, and many of these individual nutrients come from China. But the supplement companies can't always follow the course of where they are sourced. So it can be a little complicating when I have somebody that's on upwards of 15 to 20 supplements. And ideally we want to streamline it, because that can create an upset stomach and acid, and the acid feeds inflammation, which then gets in the way of the goals of reducing pain or whatever.
There is so much to think about, because I mean, like you said, I mean, I do a lot of research on different supplements, and I mean, I used to do therapy. I still use oils, and I do use my intuition as well, but sometimes you're just not that sure. That's how I feel. And I suppose coming to someone like you, you know, so that you can have that confidence that actually I am, you know, I have this symptom, or I want to feel more like this. You know, knowing that your patients have that tailored service from you, so that they.
Well, that's really that's the key. I mean, you ultimately want to be able to manage your health with your diet and your lifestyle, and there are a lot more resources available for, say, powdered plants. You can get a lot of, and they've formulated them to be very tasty, and as long as you know they're organic, where they're sourced, and you know that the plants aren't going to be conflict with your medication or with your medical history. There's a tremendous amount of resources available now that weren't available when I first started practice. So I very rarely.
Good for you then, isn't it? That's because people come to you who are more knowledgeable, much more knowledgeable about their own needs, I suppose.
Yeah. And I want to encourage patients by educating them. So I do aim to explain some of the science so that they walk away with a mental picture, so that they understand that what they're experiencing is not just in their head. They're not just making it up. That my work shines in the nuances. So you really do need to at least have perhaps opened your mind to the fact that there are alternatives, perhaps that may work more efficiently. But most of the people that come to me have tried a little bit on their own without success.
Right. Okay. Yeah. I see.
So but the same thing with, I would imagine, some amount of astrology is general knowledge, but I would want to consult with an astrologer for the ideal timing of surgery, let's say, I can't predict that for myself. I don't know enough.
Exactly. And to know that, takes a bit of research, training and time, doesn't it? So
I think
or in your case, a lot of time and a lot of studying. I mean, years.
Well, same thing for astrology, right, Armand?
It's a sort of lifelong thing, really, isn't it? You're always learning astrology, aren't you, Armand?
Yeah, no, you're always. I mean, if you're doing anything well, you should be continually learning it, right? I mean, you should.
It never stops.
No point where you should say, "Oh, that's it, I got it down. I'm not learning anything else." I think though, that it makes so much sense. Like the difference between maybe doing a little herbology for yourself. If once in a while I don't sleep all that well, I should try a little bit of this. It's different than I've got chronic insomnia. Then I should go to you. I mean, there's I think, as you were saying, the size of the problem has a lot to do with the way you're going to approach it, or whatever you're interested in. If it's a big deal, you want somebody who really. I think about dosage a lot when it comes to herbs. Especially in America, the way we handle it, I want a big mug of whatever that thing is, right? That's the whole thing. Is how much of this is going to be good for me? How much of it can I get in? The idea that maybe you should go on smaller doses or titrate.
I'm always into the more sort of less is more. That's always how it could be to do with my astrological chart, lots of
Well, actually,
Virgo. It's probably moon in Virgo.
Have a little bit and see what happens, and keep.
I always have less. I noticed that. Always like being on the safe side. I seem quite sensitive to things. You know.
You both made brilliant points with that. Armand made the big gulp analogy.
Yeah, I know. Yeah.
The giant big gulp at the local convenience stores that, oh, well, a little bit, that tastes great. Let me have a 20 ounce, 64 ounce. Yeah, I start with the least, I usually start with middle of the road, average dosing for an adult. However, if during the course of their medical history, I learn that they are sensitive to small amounts of things, then we start very conservatively. And I will often start at a half or even a third of a dose that I would ordinarily begin with. So it really depends on the individual. It also depends on how much other preparations they're taking, how many prescriptions they're on, how many supplements are they taking, because I don't believe in dramatic changes all at once. As with anything science or science-based, you need control variables. So if I yank somebody off of all of their supplements that they're used to taking and put them on something new, I don't know if they're reacting or responding to the cessation of the supplements or to the herbal preparation. So unless something really throws up a red flag that I know, okay, this needs to stop. For example, I'll just give you an example. Licorice root is often found in a lot of the Chinese medicine teas. So you see it even on commercial shelves. Licorice root as an adrenal tonic is put in a lot of different herbal teas. However, it's contraindicated if you have high blood pressure, if you have thyroid disease, or if you have a tendency toward cancers like breast cancer or thyroid cancer, anything where you're estrogen dependent, because licorice root has estrogenic properties. So yeah, it's a wonderful adrenal tonic. But if somebody has anxiety or acne, or like I said, fibroids or thyroid disorder, tendency toward anxiety with hypertension, that's a no-go. And we have so many other plants that we can choose from. It's not the superstar of the world.
Yeah, it's just the kind of common, well-known one. But yeah, as you said, you must know so many herbs. How many would you say, just out of interest, how many have you studied? And
how many do I have here
around the world? Are they from all around the world? Do you use?
I think it's infinite, because even weeds are just medicines yet to be discovered.
Like dandelions, dandelion
like
root.
that.
I've never tried dandelion root, but that, for example, dandelion.
Oh, dandelion is a staple in many formulations. It depends on what part of the plant you use. Aerial parts of the plant is more for fluid retention versus, say, the root, which is more liver, bowel. And you can think about it in the roots. You think more of the bowel. It's underground. It's hidden. So it's
grounding. And do they often they're sort of working on being grounded in some way? The lower.
Right. So again, there's I would say very rarely am I using one plant on absolutely everybody. That doesn't happen, and that's often why I have had an issue trying to record social media videos, because people say, oh, can you talk about what herbs are good for this or that?
Yeah.
And I say, I wish I could, but I'm my own devil's advocate. And for every plant, there is somebody that it is not ideal for. And I don't want to tell people, take this plant for this issue, because it could harm them potentially. So I've always had an issue trying to think of what I can put on social media. And that's why being asked by you and Armand today was such a compliment to be able to have this conversation and put things in context, because I can't do a 3-second TikTok and point to little bullet points here and there because I always, and maybe that's because of my own astrological chart. My moon is in Libra, and I have problems with decisions, but the other in terms of emotional decisions, I can always get in my own way and say, oh yeah, licorice root is great, but it's not good for so many populations. I would get myself into hot water if I said, oh, everybody take this plant for adrenal support, because it's really not safe or effective for them. So.
Well, I think we know it too. Like the idea that you can somehow or another condense everything into a Twitter appropriate, TikTok acceptable size. It just really isn't. It isn't the way to run a profession, really. I mean, it's kind of a couple of things, but that's
overwhelming, isn't it? As sometimes when you try and do that, do you find that?
Well, that's why I've admired the two of you, because you have done videos. That's how I found you, is through the videos that you make, and they have been very helpful, and on a general level. But if I really have a specific conundrum that I'm dealing with, then I really do need to speak with you on an individual one-on-one, take a look at the big picture, and that's ultimately what I do in my work as well. You can't just say, oh, well, I have chronic migraines, you just take this one plant for it, when you really have to look at that bigger chart that you, just like you do.
Oh, that's true. Well, thanks so much. This was really great. Thank you so much.
Thank you, Tami. It's really lovely.
I hope I answered the question. My brain often has so much going ahead of me, and it doesn't always come through as I would like it to.
Fine.
It's been wonderful, and it's going to be great for the viewers and the listeners to hear you and see you today, and really wonderful advice and tips and wisdom that you shared with us. Thank you very much.
Thank you, and I really enjoyed myself today.
Fantastic. So did we. Take care, and we will see you soon. Bye-bye.
Thank you.
Bye-bye.